Good evening. My name is Serena McNeely, and today I have the opportunity to present on the work that I've been doing over the last 3 to 4 months to aid my practicum site with nurse leader visits. I am currently an MBA MSNL graduate candidate and have been working with several team members at my practicum site to improve the patient satisfaction scores through nurse leader visits. Let's go ahead and dive in. My chosen practicum site is Baptist Memorial Hospital DeSoto. This is a 339-bed facility located in South Haven, Mississippi, which is on the southern border of Memphis, Tennessee. The hospital provides a wide range of healthcare services and was designated as a top-performing hospital by U.S. News and World Report. Earning a gold seal from the Joint Commission is another recent accomplishment for this organization. The gold seal is a symbol of quality that reflects a healthcare organization's commitment to providing safe and quality patient care. The certification recognizes healthcare organizations that demonstrate continuous compliance with its clinical performance standards across the continuum of care. The certification evaluates how organizations use clinical outcomes and performance measures to identify opportunities to improve care, as well as to educate and prepare patients and their caregivers for discharge. Baptist DeSoto has a very specific mission, vision, and values that they hold each employee to. The mission, in keeping with the threefold ministry of Christ, is healing, preaching, and teaching. Baptist Memorial Healthcare is committed to providing quality healthcare to individuals that come through their doors seeking healthcare services. At Baptist, the vision is to create an expert system of care in the Mid-South where love abounds so that God can do the impossible. Baptist values include principles that facilitate their vision and mission and include compassionate care and service, multidisciplinary teamwork and trust, innovative and excellence, and respect for the individual and the value of diversity. It was a great pleasure to work alongside and with the leaders of this wonderful organization. To get started, it is first important to identify the needs of an organization. To do this, a needs assessment is required to pinpoint the gap between baseline and desired goal. Baptist DeSoto begins its fiscal year on October 1st of each year, so they began their needs assessment around July to budget accordingly for the next fiscal year. I started in August, right after the needs assessment was completed, but just in time for the results to come in. My practicum site had several projects to focus on in the upcoming fiscal year to improve HCAHPS scores. HCAHPS stands for Hospital Consumer Assessment of Healthcare Providers and Systems, which is a survey instrument and data collection methodology for measuring patients' perceptions on their hospital experience. To target their HCAHPS scores, Baptist DeSoto decided to focus on the following areas: nurse communication, nurse leader visits, bedside shift report, and service recovery visits. While most of these were already implemented, they were not 100% effective, so the organization decided to focus on the knowledge, skills, and abilities of their leaders and staff to appropriately perform the aforementioned tasks. From there, the patient experience coaches categorized the needs into 3 levels of training based on the hospital's goals and the knowledge and skills required for the goals at each level: organizational, operational, and individual. Based on the list previously shared, the CNO appointed me to assist the patient experience coaches with the improvement of nurse leader visits. Baptist DeSoto practices CAUTIC coaching and Struder methods. According to Struder, the most successful nursing care model is one that meets the needs of patients and families and provides evidence of positively impacting outcomes. To improve patient satisfaction scores on the HCAHPS survey, Baptist DeSoto is focused on warm welcomes, fuzzy farewells, and of course, everything in between. At Baptist DeSoto, nurse leaders are required to round on 8 different patients per day, Monday through Friday only. Between the warm welcome and the fuzzy farewell, the goals of these patient visits are to build relationships with patients and their family members, obtain positive and constructive feedback, and ensure consistency of care is being delivered. After rounding, the nurse leader should then follow up with pertinent staff members with opportunities for improvement and/or share positive feedback. For patients that are displeased with their care during their stay, the nurse leader visit then converts into a service recovery visit. My role in the Nurse Leader Project was focused on two main areas. One, developing tactics that will serve as a foundation for nursing care excellence, and two, implementing a strong framework that will achieve professional nurse leader execution with full participation and engagement. Since my project focused on two areas just discussed, my outcomes are also twofold. By developing tactics that serve as a foundation for nursing care excellence, the outcome we expect is improved and consistent nurse leader participation through establishing a rounding discipline. By working with senior nursing leadership, nurse managers were able to eliminate the time barrier by implementing no meeting times from 9 a.m. to 10 a.m. This provided a time block for nurse managers to complete this task. The outcome of this time block is that nurse leaders can complete the patient visit and rounding log. Rounding logs are then provided to senior nursing leadership in a weekly report to track patient satisfaction results by unit. The organizational outcome is improved HCAHPS scores. Nurse leader visits became a higher focus on October 1st when the patient experience team rolled out iPads to electronically document the nurse leader's performance and results of these patient visits. As of November 8th, 2023, the patient survey rating for Baptist DeSoto is 2 stars. The intended outcome is to increase patient satisfaction or perception of care on topics such as how well nurses and doctors communicate, how responsive hospital staff are to their needs, and the cleanliness and quietness of the hospital environment. By doing this, the outcome will be a higher star rating in future CMS hospital data reports. Providing evidence-based research to the various stakeholders to demonstrate the value of nurse leader visits was more challenging with the nurse managers than with the nurse executive leadership. To gain buy-in, I needed to emphasize how these patient visits could reinforce the organization's goals and vision by providing opportunities for employee recognition, which also has the potential for improved employee retention, heightened perception of care by patients, better quality outcomes, increased market share, enhanced safety, and reduced risk. The CEO and CFO, along with the nurse directors, received the information well and were kind of excited to get the project rolled out. The nurse managers, on the other hand, were hesitant to take on this responsibility and complained mostly of time constraints. A survey was completed at the start of the project to collect nurse manager opinions on the importance of nurse leader visits. Within a few weeks, nurse managers understood the importance of nurse leader visits and shared their feedback. Some of the feedback I received included understanding things from the patient's perspective, fixing issues in real time, providing the manager with feedback on the patient's perception and satisfaction of their care, promoting quality improvement and facilitating patient safety, the opportunity to improve accountability for staff, and a leading indicator to gauge current HCAHPS measurements. Overall, the stakeholders were receptive to the project and worked with me and patient experience coaches to implement the change. Sustaining an improved outcome or process is a known challenge to healthcare staff and stakeholders. There are key ways to improve sustainability within a healthcare system, and there are various models, tools, and frameworks developed to improve the sustainability of evidence-based interventions. My project surrounding nurse leader visits should be sustained, and the handoff to patient experience coaches has taken place. Nurse leader visits are a necessary improvement for the hospital to improve its HCAHPS scores around patient satisfaction. These patient visits allow for nurse leaders to get in front of the patients, hear what's going well for their stay, but also what's not going well. The latter of which allows for service recovery to be completed to turn that patient's dissatisfaction into contentment before they're discharged. The sustainability of a nurse leader visit can be maintained by several attributes, but specifically transparency, staff participation, and patient engagement. The AONL Nurse Leader Core Competencies provided the framework for the knowledge, skill, and abilities associated with effective leadership. The goal I set for myself during this course was to gain experience in as many of the Nurse Leader Core competencies as possible. I achieved at least one skill from each of the 5 domains. Since one of my project goals was to gain nurse leader buy-in, I gained the most experience in communication and relationship management. This was achieved by communicating with clarity and integrity to build trust with the nurse leaders. Through influence and persuasion, build consensus and gain cooperation from others to share information and accomplish the goal. Knowledge of the healthcare environment and professionalism were equally important for my topic. Developing a strong foundation for nurse leader visits ensures the voice of the patient is central and present in decision-making. It advocates for healthcare policy at all levels of government as it affects safe, quality, and accessible healthcare. And most importantly, it represents patient care issues to the organization's governing body. Nurse leader visits can also transform care delivery models and environmental design to ensure the delivery of safe patient care that is evidence-based. This project allowed me to align and create nursing clinical objectives, goals, and tactics required to achieve the organization's strategic outcomes. Lastly, I was able to develop and encourage new insights into situations while acting as a catalyst for change. I am very proud of the AONL skills and competencies I was able to practice over the last 4 months. As I reflect on the past 4 months, what I learned from this project and experience is that leadership is about listening and persuasion. Really listen to your team as they express their concerns. Listen to take action, not just to respond. Learn what motivates your team members and use that to positively persuade them. Gaining buy-in for any change management is vital to the success of the project. Without the team having an understanding of the scope and impact, and without including them from the start, the project manager is at risk of failure. Another thing I learned is to make smaller changes over time in a continuous cycle. Don't try to rebuild everything all at once. Start small, master that change, and then add to it. Over time, you should be able to see the impact of your small changes come to fruition. Although I am done with my project as of today, I am anxious to follow the CMS patient survey results and hope to watch the stars improve from a 2 to a 3 to a 4, etc., over the course of the next year.